Hello everyone, my name is Dr Parissis and welcome to another video. In this video, I want to give you an update on my oral minoxidil journey for hair loss. Now, I started taking oral minoxidil instead of topical minoxidil for two main reasons. The first one was because there's convincing research that showed that oral minoxidil is actually more effective than topical minoxidil. And the second main reason is I found topical minoxidil quite a pain to apply every single day. It didn't fit into my daily routine and I didn't like the kind of oily feeling that it left behind. So I switched to oral minoxidil 2.5 milligrams 1 month and 2 weeks ago now. And I want to update you on an unfortunate side effect that I haven't actually seen before in any of my own patients and in anyone in general actually, that I unfortunately experienced. Before I go into that, I want to answer a few questions that you guys have been asking me. The first question is, did I notice a shed when I started taking oral minoxidil? The answer is I did notice a shed. I noticed that some of the miniaturized hairs, the ones that were kind of shorter than the other ones, they did fall out, especially when I was kind of drying my hair after a shower and kind of over touching it. But the way I see it is that if you're going to get long-term hair gains, a short-term shed is worth it. And the other question that I wanted to answer was, has oral minoxidil worked so far? Well, in my opinion, I think it definitely has. I'm actually quite surprised. I wasn't a great responder to topical minoxidil, and I noticed that my hair density, the overall feeling of the hair, the kind of healthy appearance of the hair, all improved. And you can see from this photograph here, obviously the lighting conditions are not 100% the same, but there's an overall increased bulk to the hair, and I've been enjoying that for sure. So let's jump into the side effect that I noticed. If you have seen one of my previous videos on crown loss, that was kind of the first time that I noticed change in the appearance of my skin. Specifically a red rash in the infraorbital regions just under the eye. I noticed some increased redness in these areas, but I continued taking 2.5 oral minoxidil and just kept a close eye on it. I did some research and I looked to see whether anyone else had experienced this facial rash. And I came across quite a scary research paper of this lady here who had been taking oral minoxidil for high blood pressure, and she developed an unfortunate skin condition called Stevens-Johnson syndrome. Now, this is a very severe skin reaction, and unfortunately she actually died. Oral minoxidil was believed to be the cause of her death. At day 23, she did notice a maculopapular rash, somewhat resembled the one that I had. This obviously scared me a lot, but looking into it further, I was able to see that she was taking a much higher dose of oral minoxidil than myself. She was taking oral minoxidil for refractory hypertension, which means high blood pressure that does not improve with a number of medications. So she must have been on lots of different blood pressure lowering medications before they decided to put her on oral minoxidil. And the oral minoxidil dose for high blood pressure is closer to 40 milligrams. I think it's a little bit of a stretch to worry about experiencing Stevens-Johnson syndrome when I'm on such a smaller dose. In my medical opinion, it's likely that I'm experiencing a small amount of visible vasodilation of the blood vessels just under the eyes. It's likely that these blood vessels have pooled a little bit more blood, almost like when you come out of the shower and you have some redness in the face, just because those blood vessels are sort of dilated. That's why the minoxidil has been causing this. I'm not super worried about it from a medical point of view. However, I didn't quite like the way it looked cosmetically. I also noticed an increase in facial puffiness or facial swelling. Compared to how my face looked before, it seems less defined. I haven't undergone any particular dietary changes, and the face seems a little bit less defined and more swollen. Again, not the look that I am going for, and I imagine not the look that you would be going for either. So moving forward at the 1 month mark, so 2 weeks ago now, I switched from 2.5 milligrams of oral minoxidil to 1.25. So I halved the dose, and I have experienced much less redness in the face, and I believe my facial puffiness has improved. But then the question that came to me is, will 1.25 milligrams be enough to continue to experience hair gains? I knew that 1.25 milligram dose of oral minoxidil is commonly used for female pattern hair loss, but I wondered whether it would be enough for men. I was able to look through my big bank of hair loss research papers and find this one by Kumar et al. In 2020, where 32 patients with male pattern baldness were put on 1.25 milligrams of daily oral minoxidil, and their hair gains, their hair loss response was assessed after 6 months. The most notable and impressive finding from this study is an increase in hair density of 48.4% was found in the crown area on average amongst all of those patients. This particular patient, I would argue, has definitely experienced a noticeable improvement in overall hair density. And the authors concluded that the 1.25 milligram dose is an effective dose for male pattern baldness, although the higher doses of 2.5 to 5 can still be used if there's no response. So what should you do with this information? Well, I would argue that you should take it with a pinch of salt. I'm using these videos to document my journey with oral minoxidil for hair loss, but disclaimer, this does not qualify as good scientific research, mainly because it's just one subject, myself, but I am aware of some upcoming research on oral minoxidil for male pattern baldness, but they will take time, unfortunately. Because male pattern baldness is a stressful thing, and because the longer you wait without treating it, the more hair you are likely to lose permanently, I am using this video series to help you guys decide whether oral minoxidil is an appropriate treatment for you whilst we wait for more research to come. If you're thinking about starting oral minoxidil or any other hair loss medications, if you're worried about your current stage of hair loss, if you're worried about whether your hair loss will progress, if you're worried about your family history of hair loss, if you're considering getting a hair transplant, don't hesitate to reach out to me at drparissis@gmail.com, where we can discuss all of those things and come up with a great plan moving forward to save you from losing more hair, or to discuss surgery to restore the hair that you've already lost. Thank you guys for watching.